Hi friends, welcome to Charkos. I'm Dr. Seema Balian, the founder and director of Charkos. Charkos is a healthcare recruitment and training company with over 15 years of experience in providing turnkey solution for training and recruitment needs for the nurses, doctors, and AHPs such as radiographers, occupational therapists, ODPs, and many more. Charkos operates over 3 continents in countries such as UK, Australia, Germany, Italy, and New Zealand. Our services include OET and IELTS training, CV enhancement, interview preparation, NMC and APRA registration, CBT and NCLEX preparation, visa application and flight bookings, OSCE training for all fields of nursing such as adult nursing, mental health nursing, pediatric nurses, midwifery, and learning disabilities. OSCE training is available in India as well as in UK. Orientation for life in UK. OSCE exam bookings and the logistics bookings. Excellent pastoral care. Our state-of-the-art learning platform includes reading materials, videos, quiz to enhance your learning and equip you for a positive and a better outcome. For registration, CV upload, relevant bookings, and more information, please visit our website www.charkosglobal.com. Visit our YouTube channel and subscribe our YouTube channel by going to Charcos Learning Center, our Facebook page, Instagram, and LinkedIn pages by the name of Charcos Global. So, what are you waiting for? Subscribe now. Press the bell icon for regular updates and all the information that you require. We are looking forward to seeing you on our site and being a partner in your enhanced journey. Thank you very much.
CSU, Catheter Specimen of Urine. This is a clean procedure but not a sterile one. So you will require to wear clean gloves but not the sterile gloves. You will require to take the specimen from the catheter and then transfer it to the specimen pot. Although this is a clean specimen, it does have an aseptic technique that you will need to use to transfer the urine from the syringe to the specimen pot. You will need to make sure that the tip of the syringe do not touch the rim of the specimen pot and hence contaminate it.
I'm entering the room and I'm checking for the scene safety. The scene is safe for me to enter. So before I go to the patient, I'm going to make sure I do my hand hygiene using the 7-step of WHO guidelines. So palm to palm, back of the hands, fingers interlacing, fingers interlocking, my thumbs, rotation of the tip of the fingers and the wrist. Hello, good morning.
Hi, good morning.
Hi, I'm Seema. I'm someone who will be looking after you today. So, is it okay if you can tell me your name and your date of birth, please?
Yes, of course. My name is Lu Chang. I was born on the 1st of January 1972.
Okay, that's great. So, will it be alright if I just check it with your wristband as well?
Yes, of course.
Okay, so I can see that it's Liu Chang, date of birth is 1/1/1972 and the hospital number is 0004321. So that is great. So is it okay if I call you Liu?
Yeah, that's fine with me.
Okay, that's fine. So Liu, can you tell me that if you're allergic to something?
I think I'm allergic to penicillin.
Okay, yeah, I can see that you're wearing a red ID band and in your record it says that you are allergic to penicillin. So don't worry, we'll make sure that you are not given any penicillin or penicillin containing medicines while you are over here. Okay, so Liu, just wanted to let you know that the doctor who has seen you has requested to get a catheter specimen of your urine. We have noticed that since the last couple of days you have been spiking some temperature and have been a little bit confused. So it seems as if that it is possible that you might be suffering with a urine infection. So I would like to get a specimen from your catheter and send it to the lab to get it checked that whether you are having a urinary infection. Will that be alright?
That's fine with me.
Yeah, okay. So the whole procedure is going to take around 12 minutes and it is not going to be painful and hopefully it won't be very uncomfortable either.
Lovely.
So before I leave, I will be clamping your catheter so that your bladder can get filled up. So because I'll require a full bladder in order to take the specimen. So that is going to be a bit uncomfortable. Will you be okay with that?
That's okay with me.
Okay. Also during this procedure, although I will not require to expose you so much, but I would like to offer you a chaperone if you require someone to be with you during this process.
No, I'm okay.
Okay, that's no problem at all. So I'm going to be clamping your catheter, and then I'll go and collect my equipment. Okay, Lou, so as I said that I will be clamping your catheter. Yeah, so and it is going to be a little bit uncomfortable, and you will feel your tummy to be filling up. Yeah, so please don't get worried about that. So it is not going to last for very long. So I'm going to make sure that I clamp the catheter. So just about 2 centimeters below the port from where I'm going to be taking the sample. So there you go. So your catheter has been clamped, and I'm going to discard these gloves to the clinical waste bin. Yeah, and do my hand hygiene again. So Lou, I will be leaving you with the call bell. Yeah, just to while I go and get my equipment. So if you feel that you require any help, please use the call bell. So here is the call bell that is there. So is it okay if I leave you now?
Yep, that's okay.
I'll be back in just a few minutes.
Okay.
Okay, I'm just going to collect my apron. I'm going to be wearing the apron and the gloves, and so that I can just collect all of my articles to take to the patient. Okay, so examiner, can you confirm my tray is cleaned with soap and water in the last 24 hours?
Yes.
Okay, so thank you very much. And I will be cleaning this with 70% alcohol wipe, which I have checked that they are 70% alcohol wipe and they are intact and in date. So I'm going to be using one wipe to make sure that I clean the tray from inside out in a zigzag manner for 30 seconds and leave it to dry for 30 seconds. And I'm going to put this in the clinical waste bin. I'm going to discard my gloves and the apron. And it in the clinical waste bin, and I'm going to do my hand hygiene again using the 7th step of the WHO guidelines. Okay, so I will be collecting all of my articles which are required for taking the catheter specimen. So I will be requiring 2 swabs or the alcohol wipes. I have checked that they are intact and in date, and I will require a specimen bottle, which is in date and looks clean. I will also require a 20 ml of syringe, which I have checked is intact and it is within expiry. Yeah, so this one. Then I will be requiring the info pad, which I will make sure to put under the patient so that there is no spoiling of the linen. Okay, and I will also require a fresh pair of gloves and apron. Okay, so I have got all of my articles, and I'm now going to take my tray and go to the patient side. Okay, hi Lou, I'm back again. So how are you feeling?
I'm feeling alright.
Okay, are you feeling a bit fullness in your tummy?
Yes, I am.
Oh, okay, that's great. So we will be able to take the specimen very quickly. Okay, so let me just wear my gloves and apron.
Okay.
Now I can see the port is quite visible outside, so I don't think that I will be requiring to expose you in any ways.
Okay.
Okay, I have made sure that I have already done my hand hygiene before I came over here. So I'm going to wear the gloves, and I am going to be just putting the info sheet, just slide it under the catheter so that we are not soiling the bed linen while I do that. Is that okay?
That's fine.
Okay, can you just lift up your bottom a little bit?
Yeah.
Yeah, okay, that's great. So well done for that. Okay, that's all very good. Yeah, so I can see the port. Yeah. Now I am going to be cleaning the port, and for that I'm going to be using the alcohol wipes. So I'll just put my tray under it just so that I can balance it on top of this so it does not touch anywhere where I don't want it to be.
Okay.
Okay, so I have taken the 70% alcohol wipe and I will be cleaning that one, the port. So this is the port which I will be using and it is very clearly visible, so I will be cleaning it for 30 seconds and leave it to dry for 30 seconds. And all of these I'm going to be discarding in the clinical waste. While I'm waiting, I will open my syringe. Making sure that I am not touching the port and not contaminating it. And I'll also make sure that I'm not touching the tip of the syringe. And I will go at 90 degree and push it down so that I am able to withdraw the urine. So I will be taking around 20 ml of the urine, so it is coming out nicely. So okay, that's great. So I have got 20 ml of the urine. Now I am going to make sure that I just transfer it into the bottle before I unclamp it. Yeah, so and I will make sure that I do not touch the rim of the bottle or the lid, and without touching the tip of the syringe, I'm going to transfer it using AMTT. There we go. Okay, I will be labeling the urine specimen pot, and also I will be completing the form which I have got with me, and I will be sending it off to the lab as soon as possible. If I'm not able to send it within immediately, then I will be keeping it in the fridge for just 4 hours. And unfortunately, if I'm not able to send it even in 4 hours, then I'm going to come back and take a new specimen. Okay, so that's all fine. So I'm just going to clean the port once again to make sure that it stays clean. Yeah, so again I will be cleaning it for 30 seconds and leaving it to dry for 30 seconds. So that is all done. Now I'm just going to unclamp. Yeah, I'm sure that you would feel the relief. So let me just take all of my articles. So let me take this from under you. And I am going to remove my gloves and apron. And as I said, I'm going to make sure that I am going to be completing the form and putting up all the records to make sure that it is in your record that we have sent the urine specimen. Let me just clean my hands and then I'll make sure that I'll cover you up a little bit. Okay, I hope it was all right.
Yes.
Do you have any questions, something that you would like me to explain? There you go. So let me just cover you up. Yeah, there we go. So so that's fine. As I said, I will be sending it off immediately, and hopefully the result will come in a couple of days time, and we will let you know about the results, and I'll let the doctor know that we have sent the urine specimen. So I'll leave you with this call bill over here. So if there is any problem, please do let us know. In the meantime, it would be great if you drink plenty of fluid so that we keep the bladder quite flushed and the urine flowing very well. Okay, so I'm going to take all my articles back, make sure that I discard them appropriately in the clinical waste bin, and clean this tray and make it ready for the next use. Okay, thank you very much.
Thank you.
Take care. Bye-bye.
Bye.